Hello, everyone. I'm going to be speaking on a public health issue that exists both nationally and globally, and that is human immunodeficiency virus, which is also known as HIV. Human immunodeficiency virus, which is also known as HIV, is an infection that attacks your immune system. What happens is the virus attacks your CD4 cells, which lowers your immune system, and it makes you more susceptible to other illnesses such as tuberculosis, bacterial infections, and even certain cancers. When left untreated, HIV can progress to AIDS, which is also known as acquired immunodeficiency syndrome. HIV can be transmitted in multiple ways. One way it can be transmitted is through sex, both anal and vaginally. HIV can also be transmitted through needles by sharing syringes and other drug equipment. And then HIV can also be transmitted from mother to baby. Now, this does occur less frequently and is less likely to occur. Um, it can be transmitted during pregnancy, birth, and breastfeeding. However, with advancements in treatment, it is less likely to occur. In 2021, the CDC published a study showing that 40% of all new HIV cases had affected African Americans at 14,528 new cases. The Hispanic and Latino population followed at 29% with over 10,000 cases, and the white population followed at 25% with over 9,000 cases. The Pacific Islander community had the least amount of cases of all populations. Some symptoms of HIV include fever, headache, rash, swollen lymph nodes, weight loss, and cough. HIV can't be cured, however, it can be treated. HIV is treated with antiretroviral drugs, which stops the virus from replicating. Antiretroviral therapy, which is also known as ART, helps strengthen the immune system, and this helps to fight other infections. ART therapy also lowers a person's viral load of HIV, which helps to stop symptoms. And currently, people can actually become undetectable, which means that the viral load is so low that it cannot be detected in a normal blood test. And sometimes this means that HIV patients will not transmit the virus to other people via sex. There is additional HIV treatment. Advances with HIV treatment have led to the development of medications that help prevent the transmission of HIV in the event of possible exposure. There is PrEP, which is pre-exposure prophylaxis, and then there is also PEP, which is post-exposure prophylaxis. Now, HIV does affect certain populations at a disproportionate rate. HIV affects African Americans, the Hispanic and Latino population, transgender people, men who have sex with men, and younger people at a disproportionate rate. Many of the disparities exist in healthcare due to the virus, and the disparities include linkage to care as well as retention of care, and poverty, systemic racism, stigma, lack of transportation and housing, as well as mental health issues substance abuse, and incarceration all contribute to the existence of these disparities. Now, the Healthy People 2030 website does have objectives that they have published regarding HIV. And some of these objectives include knowledge of status, reduction of new cases, and an increase to linkage of care. The first objective on the Healthy People website is increased knowledge of HIV status. As of 2017, 85.8% of people who were living with HIV knew and were aware of their diagnosis. The Healthy People target for those living with HIV who are aware of their status is 95%. An additional study was done in 2019, and that data showed that 86.7% of people living with HIV were aware of their status. So this indicates that there is little to no detectable change of this objective. Objective number 2 is to reduce the number of HIV diagnoses. And in 2017, over 38,000 people were newly diagnosed with HIV. The Healthy People target for this objective is 3,835 people in 1 year. Another study was done in 2020, which showed that over 30,000 people were newly diagnosed. So the data for this objective shows that the status for this objective is improving. And a third objective from the Healthy People website is to increase linkage to HIV medical care. And so a study was done in 2017 showing that 77.8% of people 13 years or older that were newly diagnosed with HIV were linked to medical care within 1 month of their diagnosis. The Healthy People target for this objective is 95%. A study was done in 2020, and the data from this study shows that 82.4% of people 13 years or older were linked to HIV medical care within 1 month. The data for this objective shows that the status is improving for this objective. So, as I stated before, there are health disparities that exist due to HIV. And most of these disparities that exist occur within incidence, prevalence, and access to care. The National Institute of Health reports that some major barriers to care include stigma, discrimination, and bias by medical providers. HIV does typically affect lower income populations at disproportionate rates as well. And one reason that is a contributing factor to this is limited health literacy. Um, there are HIV diagnosed patients that have low literacy, and studies have shown that they're less likely to be as knowledgeable about the disease as well as its treatment. And as a result of this, they are less likely to be non adherent to treatment plans. In addition to those health disparities, an article published by the American Journal of Preventive Medicine reports that African Americans have a greater risk of prevention to AIDS than uh, white people do. And this is possibly due to access to treatment and adherence. Other barriers to care include unequal access to Medicaid. Currently, 40% of people with HIV rely on Medicaid, and 82% of uninsured patients that have been diagnosed with HIV rely on safety net programs such as the Ryan White HIV/AIDS program. So the question is, how can we combat some of these HIV disparities? And one way that this can be done is by conducting more research regarding HIV to cover different bases and get different data regarding incidence, prevalence, and linkage to care. Some of these research projects can include new models for research so that they cover different bases. And one way that research can be conducted is through community engagement. Another way to combat HIV disparities is by developing education materials and strategies that are not only culturally competent but sensitive for those HIV patients that do have lower literacy levels. And this can even include the labeling, packaging, and instructions for their HIV medication. And in addition, medical providers should create a stigma and discrimination free and more supportive environment for HIV patients that also includes substance counseling and mental health care. Thank you for your time.